So I'm going to talk about what is wrong with the witch doctor. I'm sure most of you have heard about the witch doctors. They have been around for more than 1,000 years, but their name is a gift from our colonial masters, which came about somewhere in, I believe, the early 19th century. So healers of the mind, the body, the spirit, 80% of Africans still consult them, barring a minority who have a faith in harvesting human parts and cannibalism to be true remedies that aid human beings. A majority of the witch doctors rely on plant and animal-based remedies. Their patients don't quite understand their methods completely and why they use those methods, but they appear to be content with what's going on. And that is why therapies like where a patient is lying down on a straw-based couch and listening to a series of are fairly common. Patients, but they don't know how long it's going to last and whether it's something that will address their challenges or issues. Witch doctors are despised more than they're admired, and they are chastised for their methods, which are considered primitive, and they are said to be people who lack the knowledge about the human body. You might be wondering where I'm going with this, but just bear with me for a second. Consider the prevalent modern medicine that we have. So you get fever. What happens? The doctor prescribes an antibiotic. You get infection, antibiotic. Cough, antibiotic. You know what happens when the antibiotic is not working? Then you get the experimental antibiotic. But what happens if that doesn't work either? Then you go for the carpet bombing, which is steroids. But the question is, what happens if the carpet bombing doesn't work? Then, my friends, you make a truce with the disease, just like the Allied forces did in the Taliban conflict in Afghanistan recently. The problem is that we are not asking the doctors why this is happening to us. And one of the reasons is that we are fed up with the textbook responses that are now bordering on horoscope speculation, or should I say horoscope speculation. So we are at a tipping point experiencing the phenomena which is called the superbug. We are vaccinating the bug for years now. I read somewhere that in 2010, the number of units of antibiotics consumed was bordering 76 billion. Just imagine what has happened in the past 11 years. So the World Health Organization is concerned most about is the resistance to antibiotic that is a growing global health challenge. Let me share an example of my own, and this is particularly about how modern medicine is working. My father had an open heart surgery about 17 years ago. And this happened when he was diagnosed with multiple arterial blockage. And as the foremost village idiot, I went forth and asked, why did it happen? The doctor looked at me through his glasses, reading glasses, and said, your father has that your father has a smoking history. I said, yes. And this ailment is also in your part of your hereditary diseases. I said, yes, there you go. I said, fine. So he went through the heart bypass surgery and there was a bypass created to the arteries. 6 years later, he started experiencing the chest pains again. So we rushed him back to the hospital. And as the foremost village idiot, I said, okay, what now? The doctor said, we believe that his arteries are calcified. Okay, why did it happen? Well, I think his bloodstream has more calcium than it is supposed to have. Okay, why did that happen? There could be multiple reasons. And that's when I stopped listening to him. And I got this epiphany that the doctor is probably slightly less clueless than we are, and a tad more clueless than the witch doctor. Modern medicine, it appears, is based on symptomatic treatments. You get a headache, you pop a pill. You get fever, you pop a pill. And the symptom goes away for a while. Trillions of dollars are being invested just to come up with drugs and treatments that do just that. But you'll ask me why? Well, the reason is that if you can keep an ailing body alive long enough, you can actually multiply that investment many times over. So suddenly the witch doctor's appeal has quadrupled in my mind. At least he won't cost me an arm and a limb unless he's the body harvesting type. So the question to ask is, who deserves clemency? The witch doctor or the modern medicine man? Thank you very much indeed.